It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: gastritis in dogs, symptoms, causes, diagnosis. If your pet suffers from excessive vomiting, consult your veterinarian. An examination may reveal that the gastric mucosa is inflamed. This can cause complications such as irritation, infection, ulceration, and blockage of gastric function. Gastric acid secretion will also increase. When the condition is severe, your dog may continue to vomit daily without relief, thus becoming a chronic condition as the stomach becomes inflamed. An endoscopy will be one of the tests performed during the diagnostic process. Suspension of food and administration of gastroprotectors may be necessary to stop gastritis. Gastritis is an acute or chronic syndrome that causes vomiting and gastrointestinal inflammation. This can cause gastrointestinal upset that presents a wide range of symptoms. 1. Symptoms of gastritis in dogs. Most dogs suffering from gastritis will experience severe vomiting. The vomit may contain frothy, yellowish bile. This is especially true if the stomach is empty. Blood or food can often be seen in the vomit, especially if your dog has consumed inappropriate foods. You may notice that your pet is gagging or breathing heavily after eating or drinking. Your dog will not have the energy to move and will possibly lose his appetite. Your dog may become dehydrated if persistent vomiting lasts more than 24 hours. Vomiting blood, bile, food, or foam. Lethargy. Painful abdomen. He hunches his back in an attempt to relieve abdominal discomfort. 2. Types of gastritis. Gastritis can be classified as acute or chronic. Acute cases are usually secondary to inflammation. Chronic gastritis can be seen with conditions such as allergy or parasitic infection. 3. Causes of gastritis in dogs. There are several possible reasons for the vomiting your pet is experiencing. For that reason, your veterinarian will try to perform different tests to rule out certain causes and conditions such as tumors, strange bodies, systemic infections, poisoning, pancreatitis, parvovirus, neoplasia, dietary indiscretion. 4. Diagnosis of gastritis in dogs. Gastritis must be diagnosed by exclusion. Your veterinarian will look to eliminate other conditions that show the same clinical symptoms before final diagnosis. The initial step in determining the signs is to examine your pet's medical history. Based on the dog's medical history and the information provided by you, the veterinarian will be able to assess specific things such as existing diet, such as how your dog is fed and how often, all the foods your pet ate in the last 2 days, exposure to medications, pesticides, or household cleaning agents, exposure to a new dog in the home, any serious illness within a month or more, any past episode of diarrhea and vomiting, any supplements taken in the last month. Your veterinarian will look for any evidence of abdominal tenderness or pain, dehydration, gas, fever, bloating, or bloating. Diagnostic tests will be done and may include complete blood count to look for infection and dehydration, urinalysis to detect urinary tract infection, diabetes, or kidney disease, abdominal X-ray to look for any abnormalities in the stomach, such as intestinal obstruction, ultrasound or endoscopy to get a detailed view of the stomach. 5. Treatment of gastritis in dogs. The first treatment option for gastritis is to restore the level of electrolytes in the blood and rehydrate your pet. In this case, fluids will be administered intravenously. Antibiotics will also be given if severe clinical signs of infection are observed. You will be given prescription medications, antiemetics, to counteract vomiting. If your dog has a condition such as chronic colitis, your veterinarian may prescribe a motility agent to modify this condition. Your veterinarian may deny water and food during the first phase of treatment, after which they will be gradually reintroduced. Meanwhile, ice chips will be used to start oral fluid intake. A bland diet can be prescribed for your dog in small amounts and frequently. Recovery from gastritis in dogs. Most acute cases of gastritis usually have a good prognosis after you have received adequate hydration. If there is no improvement within 2 days of receiving treatment, the veterinarian may want to reassess the situation. Chronic vomiting will stop with elimination of the cause. Depending on your pet's condition at the time of evaluation, your pet may need to remain in the hospital until the veterinarian determines. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.